Good afternoon, everyone. Happy New Year. This is our first meeting of the year, as you all know. Just a couple of procedural things. Firstly, if you want to take a phone call outside, that's fine, but you won't be able to get back in, and it's cold out there, so you might want to just stay in the hallway. Commissioners, in order to speak and at least be heard, please press the push button, and the light goes green on the mic, and then press the push button again to stop it. You guys get that? Mm-hmm. If you want to say something that you don't want to be heard, don't push the button. All right, the first thing I'll do is get a motion to approve the minutes, if everybody's had a chance to review them. I make that motion. Okay, all those in favor? Aye. Anybody against? Great, accepted. Chairman's report, that's me. What have I got to say? The best thing I've got to say is welcome Hannah Byron. We have been able to appoint Hannah as our executive director. We're very excited. Hannah has done, in the short time that she's been in this position, an amazing amount of work at an operational level to get this program up and running. Do I have a copy of your bio here? Good job, I brought one. All right, I've got Hannah's bio here, so I'll tell you all about her. So, Hannah has, for the past 25 years, worked in federal, state, and municipal agencies and in the U.S. Congress. She has specialized in the management and governmental relations with effective organizational skills in policy, analysis, marketing, planning, fact-finding, administration to federal facilities, state and local projects. She has successfully managed multi-million-dollar budgets and intergovernmental funding strategies. Most recently, for the past 8 years, as the Assistant Secretary for the Division of Tourism, Film, and the Arts in the Department of Business and Economic Development. Hannah oversaw the daily operations of the division. She supervised the work of 50 staff in the Maryland Office of Tourism Development, the Maryland State Arts Council, and the Maryland Film Office, and was responsible for a $38 million budget. Her responsibilities including managing the development of programs to increase the number of visitors, the arts organizations, and film production in Maryland. She oversaw information technology, research, tourism development, workforce training, sales and marketing, advertising, and communications. She developed marketing and promotional programs to enhance and build the awareness for the Maryland Creative Advertising Plan that achieved the desired results. She initiated planning and development for new tourism and cultural travel production. She Hannah produced and published the Maryland Destinations Travel Guide, calendar of events, annual reports, quarterly newsletter, and other niche publications. She is a graduate of Boston University. Hannah lives in Owings Mills with her husband, Kimball, a retired Air Force Lieutenant Colonel. Currently, he is a pilot with American Airlines, and Hannah has 2 grown sons, Philip and Garrett. We're really excited to have Hannah aboard. She's got a great history of being very successful in various governmental agencies. She's had the opportunity to work with many of the commission members in her brief period here, and I think I can say for everyone on the commission, welcome, Hannah. We're excited. Thank you. And along with our change of executive director is an exciting change in the direction that we're going with the commission. We've been working very hard on the regulations, and our concentration has been regulations, 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 which has been frustrating to us and perhaps other people as well, because we really haven't had the opportunity to work on the operational part of what needs to get done. The exciting thing in January is that the regulations are out of the Commission. We still have work to do with regard to the regulations as they go through the state process. However, this has given us the opportunity to get on with what we're really excited to do and make the program real. With Hannah at the lead and with the assistance of the commissioners and Hannah's staff, we can now start working on our IT systems, our budgets, figure out how we're going to take applications, and figure out how we're going to grant licenses and get marijuana to the people that need it. So to that note, I'm going to call a meeting of the Executive Committee over the next few weeks and want to review the need for bylaws for the Commission. I also want to look at the calendar of events for the forthcoming year and any other issues which may pertain to the operations of the Commission. And when those issues have been identified, I want to work with the Governance Committee in order to put those changes into effect. And on that note, I will hand over to Hannah for her first inaugural Executive Director's Report.
Thank you very much, Chairman Davies, and thank you to everyone on the Commission. I have had a chance to talk to most of you. I'll spend a little bit more time with some of you than others. I want to thank Debbie, Eric, the Chairman, Nancy in particular. We've spent quite a bit of time together, and also the wonderful staff, Kristen and Sharon and Paula and the folks over at the Medical Marijuana Commission who have helped me transition. And in particular, I want to thank, there's a team of DHMH senior staff that I've been working with for the past 2 weeks. It'll actually be 2 weeks tomorrow that I've been on board. Feels like months. But I did have a chance to get the ground plowed a little bit ahead of time before I started. And so what I'm working on with the senior staff, and everyone has been terrific, from Secretary's office, Allison Taylor, the HR, the IT, procurement people. It's just been wonderful. And I'm really excited that I'm able to report a number of things, including we have met with some of the IT folks. We feel confident that we may be able to use the system that's currently in place. That's going to be one of the most important, key, critical ingredients in order to move this program forward. I have a time frame for operationalizing the program while the regulations are going through their process, because we want to keep moving forward. We want to look at the timelines and the deadlines from developing the physician's registry, the patient's registry, the caregiver's registry, working to develop the IDs in terms of working with inspectors, and also standing the program up with additional staff. We're looking to bring on 9 staff beginning July 1st. Those staff folks will be looking at everything from the Attorney General's office to data entry to working with inspectors. And so I will be able to talk to you more about that as it rolls out. We've got a lot of support in the General Assembly. I've had a chance to talk to Delegate Moorheim and Delegate Glenn, the sponsors on the House side. I'm meeting with Jamie Raskin tomorrow and many of the other delegates and senators who have worked so hard to get this program where it is. And so I'm hopeful that as we go through the regulatory process, and Kristen's going to talk a little bit more about that, that we will be able to report back to you in terms of the timelines and how we're going to be able to respond to the comments and the questions that go through the regulatory process. But in the meantime, we're moving forward to set up this program. There's a lot to do, but there's some great talent. I also wanted to introduce my great intern, Christina Donald from University of Baltimore, who's helping me out, and hope to bring on an administrative assistant in another couple of weeks to also help get me going in the meantime. There's a tremendous amount of work to be done. I want to thank many of the stakeholder groups and many of you that I have had a chance to meet with or talk to in the past. Thank you for getting us to this point. Thank you to the Commission, Eric, head of the Policy Committee, for getting us to this point. It was a lot of hard work, and we have much work ahead of us. So I'm hopeful that we'll be able to stay on a tight timeline and work to get these systems set up and work to get the medicine to the patients in a timely manner. I have another whole long list of people that I would love to thank, but I'm not going to do that right now. But those of you who know you've helped me, thank you so much. I really, really appreciate it. So the other thing that I've been working on, and I'm very excited to share with you, is a new website. And I have with me Dave Mitchell, and I wanted to also thank Ben Steffen, who is the executive director of the commission here, for allowing David to work with us. This website is going to go live. I know that you all need to get some information, you know, on a daily basis. We want to be able to give you that, not go through a number of hoops and hurdles that we needed to go through with the former website. So we're really excited about it. We have to populate it. It's still very new. Dave has worked on many of the websites here at DHMH. Did you want to just walk us through a little bit, Dave?
Sure. I'm the web designer for Maryland Healthcare Commission for a lot of the boards. All the websites I've designed. And they've been really successful. This design is based on something we're using, and it kind of changed a little bit, but it's very usable. And the nice thing about this website is that staff can update this website very quickly without going into an IT person. It's very interactive. We have a whole admin section in the back that runs the website. The website is designed for the user. Hannah has identified a number of areas, a number of stakeholders, and we've divided this website into areas for each stakeholder in this so they can get the information fast. We also have links for the commissioners, contact information, meeting schedules, news and updates, frequently asked questions, which will be available shortly, and then under education, we're going to be posting various seminars and conferences, things like that. Under laws and regulations, that type of information will be here. It will all be in one place. Then there will be information for patients, physicians, dispensaries, and growers. None of this has been filled with information yet. It's an ongoing work in progress. Going back to the home page, we'll always have the commission meeting information to the right. We'll have any kind of announcements to the left. So it's very easy to use. It's not cluttered. It's built for the user. A lot of websites, you can't find anything. We tried to make this website so that you know what you want to find, you can find it very fast. And we also have a little information on whom the site is named after. Hannah thought that was important because some people asked a lot of questions about that, and so we have that. And that's about it. It's a work in progress, and I hope you like it, and we'll continue to upgrade it. And as with other sites that we do, we like to get feedback so that we can improve the site based on users. With the Board of Physicians, we get a lot of feedback over the years, and every year we improve the site for them. So we hope to do that here. This isn't, fixed in stone here. We can make it, to meet the needs of the user, because that's what it's for.
Great. Thank you so much again, David. And in fact, under, I believe it's education, there are a couple of upcoming trainings and seminars that are going on, one with MedCon and the other is the National Medical Cannabis Conference. So we're going to be trying to populate it with information that will be useful to you, either in terms of conferences or meetings or research, news and events. The meeting schedule, also there is a link to the regulations, and so we hope you'll like it. Again, it literally is about 2 days old, but we are going to have it go live. I also wanted to mention very importantly that we also have an incoming Secretary of the Department of Health and Mental Hygiene, Secretary Designee Van Mitchell. and we will be briefing him in the days ahead. He was just appointed. He was the Deputy Secretary at the Department of Health and Mental Hygiene, and he's a former legislator who served on the Health Appropriation Subcommittee. So he's a secretary that's coming in that really knows his way around. He knows the issues. He knows Annapolis. So we're really excited about working with him. In addition, we've been working with Brett, our AG, Assistant AG, over the last year and a half. And Brett, I think you had an announcement.
Thank you, Hannah. Yeah, I did want to let the Commission know that, regrettably, this will be my last meeting as counsel for the Commission. As most of the commissioners who are here, and maybe some in the audience who were at our first meeting in, was it September of 2013, know, this program started off much, much smaller than it is now, and we thought we were going to write some regulations about academic medical centers and look at their applications, and that was pretty much going to be it. It's grown much larger, and I need to focus some of my efforts back on my original Attorney General's office clients. Your new counsel is here today, and her name is Erin Purdy, and she's sitting over here. And you're all going to be in very good hands with Erin. Also, just to let you know, as I mentioned, I'm not leaving the Attorney General's office, so particularly through the regulatory process and the responding to the comments on the regs, I'll be working closely with Erin, kind of helping her in any way she needs me. And I'm sure that if she ever needs to miss a meeting and needs coverage, I'll be the first that she will ask. So I'm sure I'll see you all again, and it's been a pleasure, and thank you.
Thank you for all of your work, Brett. So that was pretty much my report, but I wanted Kristen Neville to go into a little bit more detail, if you could, Kristen, about the regulatory process and what folks can expect.
Thank you, Hannah. This is an awkward way of speaking. I hope everyone can hear me. The
there you go.
Oh, okay. I think, yeah, I can hear myself. Good. The regulations are currently, as has been referenced already, in the public comment period. This is part of the regulation promulgation process for where the public gets to review regulations and communicate with the department their comments, what they like, what they don't like, what they want changed. They've been published in a document, I'm going to hold it up right here, called the Maryland Register. It's, as you can see, a white document with the State House on the front. It's available at your local public library as well as online. If you just go to your favorite search engine and Google Maryland Register, it should come up. It's published by something called the Division of State Documents, which is not within the department, but it publishes all regulations promulgated by departments and agencies across the state government. You can also find a link to the regulations on the department's homepage. If you, again, go to your favorite search engine and Google Department of Health and Mental Hygiene, the homepage will come up, and there will be a link off to your left called for proposed regulations. You hover over that link and a little menu will drop down, and you click on the proposed regulations link, and it'll bring up a list of all the department's regulations. And because the Marijuana Commission is subtitle 62, it should be right at the bottom, but it's very clearly marked Natalie LaPrada Medical Marijuana Commission regulations, so you can pull that up and you can read the regulations proposed to your heart's content. There's also will be instructions in that link for how to comment, and this is very important. In order for your comment to be an official comment, which means the commission will have to respond to it, it needs to be submitted to a woman named Michelle Finney, and the correct spelling of her name is in the register, as well as on the link to the website, to the regulations. You can submit comments by fax, by email, or by postal mail, and all of that information is in the announcement. Please do not send your comment directly to the commission. It will not be an official comment in that respect. If you must send them through Michelle Finney's office in order for them, and then she will forward them to the commission. This is just so she can keep track of what comments we get, and she can make sure the commission responds to all the comments. She will also keep the secretary apprised of the comments that we're getting. her office manages and coordinates the regulation process for the department. So whereas in the past, last summer, you were offering your comments and suggestions directly to the commission, that is not going to be the case during this period. From January 23rd to February 23rd, they do not send them directly to the commission. They will need to go through Michelle Finney's office. Like I said, the comment period ends February 23rd. Anything that you submit after that date, I think Michelle generally will forward them to the party that promulgated the regulations, but you may not get a response. It will depend upon the volume of comments that we get. That's all I really had to say. Eric, was there anything I left out, you think?
Eric, do you want to get?
Okay. And the policy committee met a couple weeks ago to discuss how we were moving forward. So.
Thank you, Mr. Chairman. Thank you, Kristen. There's little that I need to add.
Okay.
Okay.
I didn't mean to put you on the spot. Sorry. Just want to make sure I don't leave anything out and everyone has all the correct information. So once the comment period is closed, then the commission will start the process of going through the comments we get and responding to everybody.
And just to maybe follow up, Kristen, in terms of some of the comments that the public might make, some may be considered substantive and will not be able to be changed in the regulations, and some possibly could. So that'll be something that is worked on through your office and the Attorney General's office and the Policy Committee and others.
Right. That's a good point. If you find like a typo or something very minor in the regulations, please feel free to let us know about that as well. I mean, it may sound nitpicky, but there are lots of little things that need to be done to make sure that the I's are dotted, the T's are crossed, and that legally these regulations pass muster if there's ever a court challenge. It doesn't often happen, but sometimes it can. And the non-substantive comments we can fix very easily. More substantive comments would involve a much longer, lengthier process, but that's a good point. Thank you, Hannah, for reminding me about that.
Yes.
Christy, could you give us an idea of what other steps are needed for the final and approved regulations? I know there's a legislative committee that has to look at the benefit of the commission.
Sure. Well, sure. Once the public comment period is over and all the regulations all the comments have been responded to, the commission will then have to decide if they want to adopt the proposal of the regulations as we proposed them, as they were published, or if they want to make changes. If we want to make substantive changes, then we basically start the process all over again. If you want to make non-substantive changes, then you can make those, and then the proposal will move forward. There's some internal department sign-offs that would need to be done. I think the secretary would need to look at the proposal finally as well. And then they would be published in the Maryland Register for what's called final comment. Now, the final comment period publication, it will not publish the full text of the regulations. This is an effort to save paper, quite honestly. You don't need to republish something that's already been published. And then once it's published for final publication, it will be effective 10 days from the date that it's published from final publication. But before that happens, I missed a very important step. The Committee of State Senators and Delegates in Annapolis, called the, for short, AELR Committee, will need to look at the regulations and approve them, give them basically a thumbs up or a thumbs down. And we're all hoping, of course, that they approve them and that they get to move forward to final publication.
And we can also include some of these dates on the website.
Right.
Thank you, Kristen. Eric, as chair of the policy committee, have you got any comments?
Thank you, Mr. Chairman. First, I just have to say how impressed I am with Hannah and putting together our new website. I mean, having been involved in putting together websites in my own businesses, if this is to do it in 2 weeks, this is probably record setting. Let's hope that she doesn't get stolen away by Silicon Valley from us.
I think David had a little bit to help.
Well, my hat's off to both of you, because certainly, there's the content, and I know that putting the content and the vision is key to having a good-looking website, aside from the technical skills. The policy committee, is delighted that our regulations have been published. We are excited by the challenge of now responding to the comments. We're looking forward to the comments. We know that we're going to learn a lot from the comments. I have already found errors that I believe are not substantive that I hope to fix, but I know that there are going to be issues that we're going to have to work on. We've also worked on the report on taxation and financial transactions that the General Assembly directed us to submit to them. We have a draft of a 25-page report on that, which will be moving forward. So I think that's all I have to report from the Policy Committee.
Thank you, Eric. Deb, can we get the Education Committee report, please?
So we actually have been working all along at a very low-key level, but we had our first sort of formal face-to-face meeting about a month ago, not quite a month ago. And we did a lot of work in 2 hours, but one thing we did do, and I'm going to just take a second to read this, we created a mission statement for the Education Committee just so that we knew what we were supposed to be doing, and then hopefully everybody else will know what we're supposed to be doing. And so allow me just to read this real quickly. So our mission statement: educate physicians and all other healthcare providers, patients, caregivers, dispensaries, and clinical directors about proper medical marijuana use, dispensing, and high-quality research results by creating and disseminating educational materials. Our goals are, there are 5 of them: develop and oversee physician medical marijuana training requirements, create and disseminate educational materials for patients, caregivers, healthcare providers, and the general public, oversee the education programs and activities of licensed dispensaries and their training programs of their clinical directors, coordinate with providers of medical marijuana education and training on the development of their programs, and finally, in cooperation with the research subcommittee, review and distribute publications on cannabis research on a regular basis. So as I said, some of this we've been already doing informally, but now we're good to go. From our meeting, I will just give you a couple of updates. Hannah mentioned on our website, and I think we were able to attach the most current version of the meeting announcement for March 14th. MedChi, in association with the Baltimore City Medical Society, BCMS, is hosting this workshop, which now is from 8:30 to 3:30 on Saturday, March 14th. And it is an invitation to everybody. The physicians that attend will earn continuing education credits, and everybody else just gets to be well informed. And Eric from our group is going to be speaking on behalf of the Commission for the history of the law, state, federal, just lots of legal matters. There are a number of other speakers. There's a couple physicians. There's a PhD psychologist. And there's someone from the FDA. So I think it's going to be a good Saturday. I'm personally planning to attend just as an observer. The other thing that's coming up at the end of the month, and I want to make sure I have this correct, it's ASA, Americans for Safe Access. It's their annual big meeting. It is in Washington, D.C. this year, March 27th through 31st. It's the National Cannabis Unity Conference, and it is basically 3 full days and 1 partial day of speakers, not just research, not just medical. It's going to be business, growing, dispensers, but there's also going to be a short CE course as part of this, so that if physicians just want to attend that and just pay for that, that's a very reasonable cost. So that's the second opportunity just in this month for physicians that are interested in learning. So those are the two things coming up in March. As far as within the commission, we are working on some frequently asked questions. We got the questions, we just don't have all the answers. And the answers are sort of a moving target right now since we're in the middle of, we're not in the middle of the process, we're hopefully getting to the end. But some of the answers that we have crafted, we realize might change once the regulations change, if they do, before final enactment. So I think that what Hannah and I have discussed is that there are some, probably a dozen or so that are easy to answer that might be helpful. So we're going to work to get those done now, and those will go up on the website immediately. And then the more complicated and probably more interesting questions and answers are going to follow. So we got that going. The other thing we have done also, and this will be part of the IT system among all the other parts of it, will be we started drafting forms for the physicians to become qualified, patients to become certified, caregiver forms, the written certification, and form for minor patients. So that all has been sort of rough drafted, the first pass, and that's going to be turned over to the IT people so that they can structure it appropriately. So we got that kind of finished, at least through the first step. The other thing we're working on, too, just as an educational piece coming soon, will be, and this will be once again after the regulations are in effect, sort of an important facts for physicians. This will probably be about a 3-pager. And once again, this will be to help them. We want to do anything we can do to help them so that they understand the process, they understand what they have to do, what the patient has to do, and also to sort of make them feel comfortable and welcome them into the world of recommending medical cannabis. So I think that was about it for those 2 hours. Thank you.
Thank you, Deb. Obviously, the Education Committee has been very busy. Great job. Thank you. That's the end of our reports. So is there any other discussion?
I did have John Gontram I wanted to introduce, who is here from the Comptroller's Office. He is not officially on the commission yet, but we expect that momentarily. Andy Schaffel, I believe is how you pronounce his name, who was the former representative of the Comptroller's Office, had to resign from, had a lot going on, was a wonderful member, I understand, and so Andy will be joining us formally, I hope, at our next meeting. John, thank you. Eric and I had a chance to meet with him last week, and I think he's going to be a great new member. So thank you for coming, John. Also, we do have a commissioner online. Michael, can you hear me, Dr. Horberg?
Yes, I can. Yes, I can.
Okay, great. I didn't know if there was anything you'd like to add or to share with the group.
No, just we're all very excited for all the work that's going on.
Great.
Thank you.
Thank you.
Yes?
Question for Ted. Will the commission as a whole have an opportunity to look at these forms that we put on the website?
Oh, absolutely. Yes, yes, of course.
Yeah, I was going to say, in fact, the chairman alluded to some of the committees that we're going to structure, and operations is going to be a much more functioning and important committee as we move forward, and I've had a chance to talk to Nancy about that. So looking at everything from the registries and the IT needs in the application process, and making sure that the commission is fully engaged in looking at all of that, because it's going to be the important part of getting this program up and running.
Where the website is.
We can talk about what the process is for that, David. Okay, great.
Can I just answer, Dario? I just want to make sure the Education Committee does not plan to do one of the operational stuff like form drafting. I just had a few free minutes. I don't know, but anyway, no, it was just something that we wanted to get started, but it is absolutely going to be part of the operations group and the staff.
Any other discussion? Do I have a motion to adjourn? Okay. Those in favor?
Aye.
All right. We are adjourned. As usual, everybody's welcome to stay around, chat, meet with the commissioners, et cetera, and thank you very much for attending. And please watch the website for the date of our next commission meeting.
Right. Thank
Thank you.
Look forward to meeting.